in your experience, what do you think it means to thrive with an MPN?
It's a great question, right? I think taking a step back, right, when we think about our patients with MPNs, one of the questions I always have for patients are, what are your goals? And inevitably and invariably, people want two things. They want to live longer and they want to live better, right? And so I think that thinking about thriving with an MPN to me is about how do we minimize the impact of an MPN in someone's life. And that means a couple of things. One, that means how do we deal with symptoms or things that are causing medical problems? But number two, how do we deal with the anxiety of the diagnosis? Because in many cases, in my experience, that can be just as detrimental to somebody's well-being as the actual physical symptoms of the disease.
When it comes to choosing therapy for polycythemia vera, essential thrombocythemia, or myelofibrosis, it's important to work with your healthcare team to identify what is going to work best for you. So to begin, would you define shared decision-making, and why is this critical to properly managing life with an MPN?
Yeah, shared decision-making to me is really about the physician or whoever's in the healthcare team providing the patient information, all of the information needed to make a good decision. Now, that means what are we trying to do? What is the medication or intervention going to accomplish? What are the side effects? Because there's always side effects. And what do we think that's going to do, or how is that going to impact the patient's life? Where things get, I think, nuanced is that patients come to us because we have expertise. And so it isn't, there's two extremes. One extreme is that the physician says, this is the medication you should take, end of discussion. The other extreme, though, is also not helpful, which is to say to a patient, here are 5 choices, here are the side effects, you pick one, right? Our job is to lay out those side effects and the benefits, but then also help guide a decision.
What are treatment goals and how are they determined?
It depends on the disease to a large extent. Now, when we're dealing with ET and PV, the primary goal of our interventions is to reduce the risk of a clotting event or bleeding event. And that usually involves controlling the blood counts. In some cases, not in all, in patients with ET, sometimes aspirin is all we do. Myelofibrosis is a little bit more complicated because it depends on what the problem is. Not all myelofibrosis patients have the same challenges. Some have anemia that needs treatment, some have a big spleen, some have symptoms, and some have nothing, and they just need observation. So it's a bigger list with MF patients, but I think the first part of the discussion always is defining what the goal needs to be.
Mm-hmm. Well, what factors are considered when choosing therapy for ET, PV, and MF?
Well, I think a couple of things, right? One is what medication we think is going to benefit the patient best. Now, that has to take into account the individual, their willingness to take certain medications, for example, pills versus interferon injections. Some people have an aversion to self-injection, which is, we have to take that into account. What are the other medical conditions that the patient is dealing with? And the reality is, in some cases, it's cost, because these medications, depending on a patient's insurance, can have quite a different spread in terms of cost. And unfortunately, that is something we have to take into account.